So you're planning a redo nose job, and I mentioned the main thing for you is this bone. So it's sticking out forward, and so we're going to take it back. So your lip show is going to increase, and then also when you smile, it's not going to get drooping. That's first thing. Second is, of course, there's some asymmetry, and the tip is not good. So those are the main concerns that we've discussed. We're going to do that. You have a little bit of DNS, which I will look at. That's the bent nose breathing issue. I'm going to look at that also, the allergic part. And then we're also going to see if we can reduce the length of the nose a little bit and increase the proportion.
What about this area? Like, is there any bend here?
There is a slight bend, I told you, right? That will correct. It's not a major thing.
Yeah, okay.
But major work for you is in this area.
Okay.
And there's a septal issue there. Septum, two issues are there. One, it's come forward, and one inside is totally bent. So the bent part is called DNS. This is the attachment to the anterior nasal spine, which also I'm going to alter, which is not done for a lot of noses. But in your case, you need it. That's why it's sticking like that. That's why when you smile, the tube.
Exactly. It's going below,
Yeah, that's the point we've written from the last consultation, and I think that's it. Unless you want me to do anything more. Ear is straightforward, yeah. We just take it back and pin it closer. There's nothing on the ear actually. It's just, and there's going to be no scar for the ear also. I'm going to put it behind, so you won't be able to see the scar for the
totally behind. Yeah, fine. That's
nose also. There will be only one scar there. I might do a little bit here if needed. I've not planned that. I've only said I'm going to improve your columella and alar relationship. It means this and this relation. If you see, this should not be too much forward, just a little bit. In your case, it's like really coming forward. So I've not mentioned if I'll do alar base work. That's here. Only if I need to, I will do a little bit. Otherwise, I will not do.
So what did you say, doctor? There is a cut here, right?
Correct.
No cut here, but what about
corrected? That is because inside cartilage there is some issue.
Okay.
And I open and do inside, I'll sort it out.
Okay, fine. Like we're gonna remove the cartilage, right?
Not remove. I'm going to remove that bump. It's
yeah.
Because I think they have sutured in an overlying face fashion.
Okay.
Otherwise, it shouldn't be there in the first place. All that will take care. That all comes in the part of the tip work that I mentioned. All right?
Okay.
Inshallah, bye.
So, sometimes can you see the big blood in the body?
We're about to start this ear pinning surgery. You can see the distance it's away from the scalp. So you see that? This is 3 centimeters now, almost from the back of the scalp or the back of the head. Right, so we're going to show you, look at that, this is 1 centimeter now. So this ear that was here now was here earlier, 3 centimeters. So we've taken it closer to the scalp by 2 centimeters. That's what we've done effectively. So that's why it's called pinning, because we take the ear closer and pin it towards the scalp. Otherwise it's called a protruded ear, right? Earlier years it used to be referred to as the bat ears. Now what we've done here, you can also see from this side, this has also given us this kind of a ridge which looks natural, and you can see a couple of small tiny stitches there. That's just going to go away hidden under the fold. Now I've also used some stitches on the concha. That's this cup kind of a cartilage that you see. So this has also been rotated or slided in a little bit, and then we've created the grooving with the cracks, and then we've taken the entire ear behind. So you can see some sutures behind. I don't want to pull them, you can see some sutures. Those are all resorbable sutures. These are resorbable as well. So they would just go off on its own, on their own. Surgery here, we're going to show you the difference. So look at that, this is just 1 centimeter now. And that was 3.5 centimeters when we started. And I've got the incision right behind, you can't see that. It's going to be totally hidden. There's some amount of bruising here, very minimal bruising. The blue dots that you see are the marks I've used while I've done the surgery to fold and to mold this cartilage. And this cartilage, the concha as we call it, I've also sutured it down onto the mastoid. That's the bone that you have here, which I'm showing right now with my finger. So it's a combination of moving the concha closer to the bone and rest of the cartilage shape has been changed and we've taken it closer to the scalp or the back of the head. So we're about to start this revision nose job. He already had his primary rhinoplasty done elsewhere more than a year and a half ago. His main concern is, you see the tip, the relation between the tip and the alar. It's just come forward, there's a septal bone there, and he's also concerned about the fact that his lip show is very minimal. There's also a deviation, if you can see. This is the deviation, is going towards the right of the face and then going towards there. The tip is not in the midline. Issues with the dorsal aesthetic line, issues with the septum. He also has some breathing issues. So we're going to do a total redo. I'm going to narrow it here. We're going to work on the radix, that's here. A lot of work on the tip. We're going to be doing septum work. We're going to take this part back. We're going to get there a good relation between the tip, columella, and the alar. So it's a revision nose job. So we've just completed with this male cosmetic revision nose job. He had his primary surgery done elsewhere. We had to do a lot of work with his breathing, with his shape of the tip, radix. We're going to show you how he was looking before we started. So you can see the angle of the tip. And I'm going to show you close up. So you can see that the tip, the broad radix, the nasolabial angle. We've improved everything. That's him right now. Nice dorsum, nice dorsal aesthetic lines. And we're going to show you how he was. You can see the asymmetry that he had, the deviation, the issues with the tip. Let me show you both of that now. So we can this is front view. You can see the come on the angle detail. Yes, Madhu, what is she doing? So here we are, we're taking off splint for this handsome guy. And this was a revision nose job. So his primary was done, when was it done? Like 1 year ago?
2 years ago.
2 years ago. Okay. Kanyakumari, you can see how he looked before we did his redo nose job. 1 second. Just this part that was a little bit. There you go. Right. Have a look. What? Look like this from the sides. So you can see the difference now. And from the front. Look straight like this. Yeah, look straight. And pocket level. Yeah, see like that. Correct. That's when you will see the difference. And then look at the sides. I'll show you the side. Yeah. So look at this point. Now the angle, the relation with the columella, and look earlier how it was.
Yeah, it was going down.
You could see half of your nostril, maybe more.
Exactly. Yeah.
So now it's in a perfect shape, okay? Then you see the tip, where the tip was and how the tip is now. Look at that. The projection of your nose, the width, the shape, everything.
Yeah. And there is some kind of swelling also here, right? It reduced.
There is swelling everywhere.
Yes, sir.
And see, when you redo nose job, the swelling in the thing is a little bit more only. Because you know, when there's scar and when you're trying to correct the earlier surgeons, whatever things were not corrected, body takes that much more time to heal up.
Yeah, I mean, I feel like this suits my face, man. That's all I want.
I think you look super. I think
Like
you look
right now,
yeah.
right now.
See, because your face is slender
Exactly.
and now the nose is slender and pointy, it matches.
With the
very
years
well.
too. It wasn't before like this.
Correct.
So I used to like rock my hair without any hairstyle and all, but right now, like
It's good.
So like when
So we also did this ear surgery. So you can see we've done an otoplasty and I've got some of those markings done. It's gone back this side also. And we're going to show you his pictures. It's something very interesting. So his mom was like, he always keeps long hair and and he just quickly had a very short cut after the otoplasty. We haven't even removed the sutures, right?
yeah.
He's
He's pleased.
happy.
And are you happy, ma'am?
Yeah, sure. He says, Mama, see, you don't worry now, you don't have to fight with me.
Huh.
Trim my hair. Don't worry at all.
Yeah, I think I'm also very happy that
I want to like rock my hair, but I can like try different hairstyles now.
Absolutely.
Thank you so much.
You're most
You
welcome.
can go peacefully to you.
Yeah, but you still got to
Concentrate.
take more care of your nose.
Yeah.
Okay, see, remember that. Not only because it's a redo, also because you've done extensive work.
Understood.
Ear will heal faster, nothing much is going to happen. Already it's healed, kind of. Nose, no. So make sure you take good care of your nose and give it 4 more weeks.
Okay.
And then you can slowly tend to be really careless with it.
No, till June he has to take care.
So you're planning to go to the UK when now?
Like after 2 weeks, maybe.
No, little bit you postponed. Remember we were having the consultation, I said,
21, right? You said.
yeah.
Yeah, 21 is okay.
21,
Maybe.
20 till 24.
Yeah, 24.
Till
Only.
24 he has got.
Okay, so you go as late as you can go.
Fine.
Alright? And before you go, couple of days before, send us your pictures and just let us know how you're doing.
Okay.
On the review number. So we know everything is
You know
okay.
that, no? The number.
Review number is there on the discharge summary. If not, we'll give it to you again.
Like through WhatsApp or like.
Through WhatsApp.
Okay.
Just let us know. That's it. And some of the sutures on the back of the ear we don't need to remove now. If it's going to cause problem after a week, you take it off in your place.
It won't go automatically.
It will go automatically, but it might hang around for another 3 weeks or something. So why it will remain so long? After 1 week, you just take it off.
I can go to
Anyone and just take it off. It's going to be easy. Nose don't touch. Sutures are there inside your nose also. Those you don't have to remove. That will hang around for a month. Do not remove them. But the ones in the back of the ear, you can remove.
Okay.
It's difficult for her to hold the iPad, like she has to hold it above her head. You're looking carefully to find some mistakes or not like that, right?
No, nothing. Looking at the nose itself, like, I can literally, like.
Look like this also. See this view. Look up and see. Look at that.
Oh my God.
This is good, right? This view is very
So
nice.
good, yeah. The pinpoint is so good, like, he's like a
Model now.
different person. No, not model, no model, like, no model. I can't be a model.
Who says? Why not?
Ah, that's the
Why
problem.
not?
That's the
What do you mean you can't be? Can be.
Is there any other problem with my face, do you think?
No.
After this?
Your mom will kill me. She makes signs from behind.
I know that. I know that.
She's.
Don't say anything. I know that.
Your mom and me, we have some unwritten code.
I know that.
So we are good in that body language, sign language.
Yeah, even if there is any problem, negativity, she'll say that, don't say.
She will be like, Chalo, then you take care. Alright?
What about these, like,
All will
because
disappear. Those are stitch marks, but they'll disappear in
these are
time.
not there. It's
Nothing
not-
is there.
Okay. March only.
Everything removed, right? Vital rapid is there? I will check again. I think it's not there. Just don't worry, just disappear.
Okay. I got so straight. Finally, when somebody took the video, I will be straight because mirror reflection is different, right? When we took someone took the video, it's a 4K like cinematic thing, so it will be a different face.
Correct.
Not like a mirror reflection. So in that only we'll understand our real face.
Absolutely.
So every time.
But remember, your nose is going to get better with time. It's looking good now. Give it few more months.
I'm excited. That's the thing.
Yes, I'm very glad you are excited. And do send us more.
Before you leave,
Reviews.
just send a...
Yeah, that's so that we are in. We know exactly that you're fine before you go.
Fine.
And even after that, if you have any concerns, even while you're in the UK, let us know. We
Okay.
can just give you a feedback, opinion, whatever that is. Some consultation.
Okay, okay. That's
Thank you, doctor. Thank you so
The
much.
mirror will just vanish off. Other patients have to use it.
So we'll take it.